morning, everyone. Today on today's platform, we have Dr. Vijayanand Jamalpuri, who is a renowned pediatrician of the country and the president of the PediStars. So, welcome to the platform, sir.
Hello, welcome, Mali.
So, thank you so much for joining us.
My pleasure.
So, my first question to you is that can you elaborate on your journey and what inspired you to pursue your career in medicine and motivated you to join pediatrics?
What inspired me to be in the medicine, I think, as a child, when I was on like 7, 8 year old, uh, maybe by observing the doctor which I would visit, I always mad about to be a doctor. So to the extent that I would write on my notes, Dr. Vijayanand, MBBS,
Okay.
until I was age 12. Then I realized that that is wrong to do so. Then I was being told I shouldn't be doing. But then I think when observing the doctors around in my town and the respect they get, the difference they are making might have mm, inspired me to take the medicine. And you want to talk about why I've taken pediatrics?
Yes, sir.
Well, I'm more of a medicine person. Like surgery was never for me. So you know how in India when you get into the entrance, if you have a choice of everything, you choose. So initially I was thinking of endocrinology, taking general medicine, but I have got a reasonable good rank where I can, because pediatrics, I don't know still it is, but it used to be in the top. So I was told you don't need to do any specialty training because pediatric itself is a subspecialty. But later I realized it's not so true. So I've taken pediatrics because partly I like kids, partly when you deal with the pediatric patients, it's a altogether different skill, and also it gives a immense pleasure. You're not only just dealing with the child but with the families.
So, what are the latest advancements in neonatal care and how are they being implemented in the India?
Now there's a more technology coming in. We're talking about more of point of care investigations and high level ventilation strategies and taking care of smallest of the smallest babies. For example, at Rainbow Children's Hospital, we looked after a baby who is 375 grams. So average birth weight of a baby is 3 kilos when they are born term. So this baby was born 15 weeks early with 375 grams. So quite a bit is happening, but I'm saying but here because the more you know, you realize that you need to do less. So less is more at times. So you go back to the basics where the little you do to the baby, the closer you do to the nature, the better the outcomes are. What do I mean by that? What do I mean that is, well, we can ventilate a baby to high frequency of variety of strategies, but now we know that if you do less of that, your outcome for the baby is more. So now we are moving more towards the non-invasive ventilation. So, and similarly, yeah, so the less procedures, so you can do variety of central lines, umbilical lines, all those. But again, research clearly shows now that if you do anything less invasive, the better outcome for the babies. Yes, in India, these facilities are available today. The best incubators, warmers, ventilators, and all those. But when I say India, India is an interesting country. India is a country with variable resources. I would not use low resources. I would say variable resources. So you go, you have places where the basic requirement of facilities are not available, but you have the some of the world best facilities available as well. So yes, it is available, but it is patchy, and the resources are variable across India. And the work which is happening in the advanced neonatal care are mainly in the urban areas. But having said that, Indian government initiatives like special care baby units, SNCU we call, has made a significant improvement in decreasing the neonatal mortality. And again, coming back to the basics, keeping the baby warm, maintaining the blood sugars, and preventing the infection. If you can take care of this basic stuff, you can save a lot of small babies. The high technology, what is coming up new, innovative, not necessarily is going to make the you save more lives. The simple basic stuff and working towards how can we get the basics right will probably help more.
So, can these technologies be implemented in even rural areas?
Yes, but that's a very good question. So yes and no. I mean, some of them can be. So say for example, I'll give an example. So all the premature babies are prone for retinopathy of prematurity. If that means basically the retinal vessels should develop, they do develop up to 36 weeks. If the babies are born early, those blood vessels has to develop postnatally, and they develop episodically and can cause blindness in the premature babies. But because the babies are surviving, but there is no proper facilities to have a regular monitoring of these babies, so they end up, yes, they are surviving, but they are becoming blind. So what the technology where it can help, now we have remote clinic across India where the ophthalmologist is sitting somewhere in the one of the main centers, but can do the clinician or even the health, any other healthcare professions can take those retinal images and pass it on. If babies need more further care, those babies can be transferred and can be taken care. So yes, the technology is reaching, but to some extent it is not universal though.
So, what are the most pressing pediatric issues in the country right now,
Okay.
and what are the potential solutions that you can think of?
Okay. So now India is very interesting juncture uh, in the social, political, economic development. What we have here is we have still infectious diseases. We still have the problem with the malnutrition. On the other side, we also having a emerging non-communicable disease even in children. So when I say that, what do I mean is like you have increasing obesity among children and increasing emotional and behavioral problems, which are, so initially we were focusing mainly on the infectious diseases and nutritional deficiencies,
Okay,
but we still have those,
yes.
but we also have the, because of the globalization, because of the commercialization and increasingly changing lifestyles, so we have a new problems because of non-communicable disease, to the extent that we see even diabetes type 2 in kids today, which is sad. And we see lot of obesity, and we see lot of behavioral problems, autism. And so I think there's no one particular reason for this. So now we are in any very complex situations where we have to deal with all of them.
So, with your extensive knowledge and training, what are the emerging trends or the advanced technology that we will be seeing in the next decade, sir?
I mean, obviously, pediatrics is part of medicine. So, what we foresee in the next decade or so is more and more of point of care um, investigations, and we will probably have more subspecializations. So, there will be more people involved taking care of the complex babies, and also what I foresee is like the more you come to know, that you will realize that less we need to do.
Yes.
And so that is clearly seen. And now we see lot of already changes in the how we diagnose condition. For example, when you diagnose the infection, previously we used to have the cultures are the standard, and but not only cultures, now we have biofire panels where you see the PCR and the genetic material in the specimen to decide whether there is a, of course there are limitations in it. So those will take time now, but now it is in future that may become a point of care. And if you talk specific to neonatology, we may not have incubators, we may not have babies outside the wombs, but we probably have a babies who are born premature in the artificial wombs. So that may come, we don't know yet. So yeah, so the technology will definitely enhance further, and the decision making and the clinical communication will be dominated to some extent by AI. But bear in mind, whatever the technology comes in, whatever the new gadgets comes in, at the end of the day, it has to be dealt with the people and to make the difference to the people. So it's ultimately the purpose is making the difference for the people. So it's up to the clinical teams how efficiently, how effectively you make use of all this.
So you are the president of the Pedistar.
That's right.
So what is the goal of the Pedistar and how does it contribute to advancing the medical training in
Okay.
pediatrics?
So the PD Stars is a pediatric simulation training and research society, which was started in 2013
Okay.
uh, by three of my friends who were pediatric intensivists. I'm a neonatal intensivist. I joined the group in 2014, exactly 10 years ago. So what is the aim? Aim is to use the simulation as a tool to improve the outcomes of the critical children and the babies we look after. That is a basic aim. But how do we achieve that? Is through training and the research using simulation as a main tool. So, but simulation role is not just for training and education, it's beyond that. Simulation as a role in quality improvement, simulation as a role in system changes, simulation as a role in advocating the right systems. So PD Stars, by collaborating, by partnering various similar minded organization, institutes across the globe, in India, outside India, to bring all those like minded people together and to learn from each other and to using the simulation as the main vehicle to change the difference, the way we train, the way we educate, and essentially the way we provide the clinical care.
So what are the future plans of Pedistars and how do you vision those goals changing the simulation training in
Yeah.
pediatrics?
So PD Star, the name itself says training and research. So in the last 11 years, PD Stars has achieved reasonably well in the training aspect, but the research wise we still lot of room for improvement, and we want to show the research beyond the training and education at bedside, how simulation can make the difference to the clinical outcomes. So when you demonstrate that, we know that it does, when you demonstrate that through research, and the policymakers accept and implement simulation as a tool for the clinical care, for quality improvement, for patient safety, and so on. And not many institutes in India, outside India, like GSL, where GSL embraces the simulation, they strongly believes and incorporated simulation very well. I congratulate entire team for that. But we need to sensitize a lot more people to adapt and to take the simulation forward to make the difference. So the PD Stars, one of the aim is to facilitate that process. So one of the reason why I am here today in the Shapes meeting is to talk about it, how to connect, how to collaborate, how to partner with various organization, but the purpose is simple, that is making the difference. But how do we get there? The process has to be done a lot.
So my next question is in two parts, sir. The first part is about if the medical students are interested to pursue research in simulation in terms of pediatrics, what are the areas that they can focus on? And the second is that if a pediatric surgeon is interested to pursue a career in simulation,
Yeah.
what are the steps, sir?
Okay, so first come to the medical student and doing a simulation research in pediatrics.
Yes, sir.
Well, so uh, there are, you can do variety of research. So first of all, you can also see how the pediatric community, those who are on teaching and training side, also on clinical side, you can see how much people are aware using simulation based tool, how much they are aware. So you can say what I'm talking about is knowledge and attitude and practice. Do the people aware fully? I think it's still, the awareness is still patchy. So when I talk, I shouldn't be talking only the big institutes. I'm talking across the India. And so knowledge practice studies you can do. And then you can also learn how the undergraduates are being taught. Well, there is a big question whether you really need to being taught or you need to facilitate the learning. There's a difference. Being taught means I tell you what you need to learn, but facilitating learning means we'll work out together how you learn. Is there a difference? So how the pediatric, in general, the medical graduates are being trained in pediatrics, how their skills are trained, how the knowledge part, and the most important thing which we generally not great at across the globe is knowing the skills and the knowledge is different, putting them into the practice in real clinical practice different. How does transition of this medical graduate who is learning pediatrics, when we become say intern, how is it translating it? Can be a big research tool. How is the simulation, what is playing it? Okay. And the another thing, by partnering with the postgraduate trainings in pediatrics, or some medical education trainees, they can also look at the, is this type of training is making difference in the clinical outcomes.
Okay.
So that what we call is Kirkpatrick level 4. So ultimately, whatever you learn, if does not translate into the ultimate purpose,
Yes.
in our case, treating the child, giving the outcome, then doesn't matter. You may know 101 conditions, but if you don't translate, when you see the real patient, it's not going to make difference. So there's a huge scope of research in that front. But again, there are different challenges. There are some logistical difficulties. So, but I'm sure the medical students, if they are interested, then can touch upon all these areas. And also they can do whole loads of research on how do the learners feel about it, how do about this type of learning, how do they feel about it after this training, did it really make the difference in the real care as well. So there are two types. One is about the training aspect, and this training making the difference in the clinical outcomes.
Sir, if a 21-year-old medical student or a pediatrician who is graduating out and wants to pursue a career in simulation,
Yeah.
what is A to Z? What are the steps, sir?
Okay, so well, anybody can, but in fact, everybody, I would say,
Okay, sir.
should have interest in simulation based. It should be become a another mode of learning and training. It should be become a part of anybody's training. So there is nothing like, is this particular individual is interested or not interested. So it should be incorporated across every type of training. But is there anything specifics to do the simulation training to pursue as a career? Not really, but my anecdotal observation of people who do the simulation based training or who embraces that, I have seen the people who like the action,
Okay.
people like to do the things. So people who incline toward the arts and drama are more interested to it. But this is nothing to do with drama. But those are the people who believes more into doing the real things than just knowing the knowledge.
Okay.
Hope I'm making sense.
Yes, sir. Yes,
But
sir.
everybody should understand. Everybody should embrace it, but there are no specifics of if you do 1, 2, 3, 4, then only you can get into simulation. So the advice I would give to the medical student or a pediatric trainee, so if you are interested in training and teaching and research, and simulation is the way, and there's you don't need to have any basic qualification on anything. That having said that, then you may wonder, can I make a career in simulation?
Yes, sir.
Okay, can I make it? Yes, you can. Yes, you can. So now there are so many medical colleges, NMC, National Medical Council guidelines is that every medical institute should have a simulation based learning center. So there's a huge scope from that. We know across India there are so many medical colleges and institutes where they have simulation labs, but there are no people to look after. But in what role you play? So there are clinicians you take over looking after these simulation labs, which actually works better, but there are also non-clinicians who can completely take over the simulation center and make a career. But I think I would say in 10 years time, the opportunities are going to increase.
Thank you, sir, for sharing your extensive knowledge and all your experiences regarding the simulation and about the pedistars. This is truly inspiring in your journey, and I'm sure that all the people who are listening to it will be inspired to pursue their journey in simulation. Thank you,
Thank
sir.
you for the opportunity. It's my pleasure. Thank you.
Thank you.